I apologize for that. Looks like we're having some sound difficulties. Okay, so let me repeat. Apologize for that. It looks like the sound was not working. So I am going to give you the overview of what we're going to review. Today we're going to review the why we're going to be interested in discussing direct messaging and secure messaging. And on Wednesday and Thursday, we're going to review the how we're going to use these functionalities. Also, we're going to review some of how it relates to meaningful use. I started by saying that direct messaging. What exactly is direct messaging? So direct messaging was launched by the ONC, a government agency that oversees the standards for health information exchange. And it was created to facilitate point-to-point communication between providers. Basically, they saw the need for providers to communicate patient information in a secure way. And what they came up with was a set of standards and protocols that were going to make it possible for providers to share this information in a very secure manner. In order to participate in direct messaging, you need to be using a certified EHR system, which in our case is Entergy and Entergy EHR. And you also have to have a health information service provider, which in our case is SureScripts. How do they become a health information service provider? Well, they need to go through a certification process that is called the Direct Trusted Agent Accreditation Program. And in there, they prove that they're meeting all the standards that are required for health information exchange. Once they become health information service providers, they are responsible for the security of that communication. They're responsible for the encryption. They're responsible for making sure that the participants all have a direct email to communicate with. For our purposes, what exactly is direct messaging? Well, think of it as if only Gmail users could use Gmail to communicate. And in order for you to be part of that Gmail directory, you needed to go through a couple of proofing and identity proofing steps. So that's what happens. When providers want to participate in direct messaging, they need to be part of an identity proofing process. And they need to prove that they're using as I mentioned, a certified EHR system and a health information service provider. That direct address is then added into directories, national directories. For the most part, SureScripts is one of the major directories that is being used nationwide, but it's not the only one. Even though we are mainly knowledgeable direct messaging because of meaningful use, it is not the only reason for utilizing direct messaging. A lot of states have become very good at enforcing and using and adopting direct messaging for a lot of different reasons. These are just a few of the examples, the ones that I'm showing on this in the presentation. For example, in Florida, some providers are using it for the newborn screening program. So they're transmitting this information electronically. In California, they have hospitals and long-term care facilities that, as the patients are being discharged, they're sharing this information using direct messaging. In Guam, the Health Information Exchange System and the veterans are currently using direct to refer veterans to providers for different screenings. In Ohio, hospitals are using and testing it for direct to send to providers when their patients are discharged from the hospital. So even though we are more familiar with it for meeting or meaningful use, it is not the only usability. And again, it's up to your ingenuity to start using direct messaging for communicating with different providers. So the sky is the limit when it comes to utilizing this new technology. As of recently, direct message and the direct program has extended to most states in the United States, and again is being used not only for summary and referrals, but also for exchange of lab information, for sharing behavioral health information, and for other transitions of patient care. So how does it work? So we have in this graph here providers that are utilizing a certified EHR system. That EHR system, which in turn works with the health information exchange provider, makes that, creates a consolidated clinical document architecture that meets the standards for the ONC. What does that mean? That it has the sections that is required for that document to be part of the exchange, that it is set up in the format that it requires to be transmitted. So there is a lot more that goes into it, even though for us as end users, the only thing that we're seeing is an email communication, secure email communication going from provider to provider. In the background, there's a lot of encryption and a lot of information that is being documented and proved. So as the document is encrypted and sent to the recipient, the information is transmitted to its intended recipient. For our purposes, what we have is a provider using Greenway Direct. So this is what a direct message, direct address looks like. For the most part, as a rule of thumb, they have direct somewhere in the name. As you can see here, Greenway Direct. Not all of them have it, most of them do. So this is a good indicator that you're using a direct email. This provider is utilizing Greenway Intergy EHR, and it's creating a CCD. When that documentation is created, it gets encrypted as needed for the exchange and following the direct project protocol. Once that is sent to the health information service provider, that health information service provider, which in our case is SureScripts, encrypts that information and also authenticates the recipient and the sender's information, making sure that you are actually using a direct email. Once that encryption happens to make that message secure, the message is then sent to an outside provider, a recipient. That recipient has in turn to be participating with the direct project standards. They also have to have a health information service provider that is accredited. And when that health information service provider receives that message, they follow the same protocol. They unencrypt the message. They make sure that they identify the direct address for the recipient and the sender. They make it readable for end users. And then the provider is able to view that patient information in his system, which again has to be a certified EHR system. So this is the best way for me to go to show you what a direct message is. The main point to remember is it's provider to provider. It goes outside of your portal, and in order for it to be secure, it gets encrypted by health information service providers. So what does direct messaging have to do with meaningful use? In Stage 2 Meaningful Use Objective 5, which has to do with health information exchange, they are asking providers, eligible providers, to use a certified EHR system and to send referral transition of care for more than 10% of patients referred to outside providers. This is when direct messaging comes in. This is the electronic way to submit a referral coordination, a transition of care. So the first part we're already meeting, which is we are using a certified EHR system, and Greenway has its products, Intergy EHR and Intergy, and direct messaging, all accredited by the Direct Trusted Agent Accreditation Program. And also in the last version was also compliant with all ONC certification requirements. So on that sense, you don't have to worry, you're meeting this measure for this objective. The next part of the objective is to actually, when a patient is being referred to an outside provider, to actually go generate the exchange document and transmit it electronically to that provider. And you need to do this for at least 10% of all the referrals during the reporting period. So those are the two pieces of this measure that you need to make sure to comply with this measure. Okay. As a reminder and as your information, and today, again, we're not going over the how to do this. I'm going to show you in detail how to actually submit a referral summary via direct messaging. I'm just giving you an overview of direct messaging today, but the other thing that I wanted to add is right now the measure for stage 2 is only asking you to submit for 10% of your total referrals, the referral electronically. Well, in stage 3 meaningful use, that number goes up to 50%. So it is important for you to start becoming familiar with these functionalities as the measures and meaningful use are increasing and the goals are increasing. So now that we've discussed secure direct messaging and how the main functionality is to be able to send secure information provider to provider, we're going to go over what is secure messaging. What secure messaging is, again, it's a very secure email sent to communicate, but in this case, for secure messaging, it goes provider to patient. This is communication between the provider and the patient, and this is a way electronically for patients to ask questions about their care, request refills, request appointments, update their insurance information, and ask any general questions that they might have to the patient, to the providers. Why is it important? It facilitates patient care, and it's been known to improve patient customer service and also the care for the patients when the organizations start promoting secure messaging to all their patients. It helps with the coordination between visits. It helps, it stops the phone tag between the patient and the providers. It's able to address questions. The providers are able to address questions directly with the patient, and some patients even find it easier to discuss over emails. Sorry, I'm just going over some of the chat comments. I just want to make sure that everybody can hear me. So again, secure messaging is a secure way for providers to communicate with their patients. Now, one of the biggest difference with secure messaging, the biggest difference between direct messaging and secure messaging is that the information does not leave your portal. While direct messaging goes to outside providers and it goes to different portals, secure messages stay within the Secure Portal community site. How does the patient find out that they are receiving a secure messaging? Well, the provider who generates, again, a clinical summary, a referral summary, it could be any type of documents that meet the exchange requirements and the standards, generates the document, and sends it to the patient portal. The patient then receives a notification that they have information in their portal and that they need to log in to see it. As you can see, it never leaves the portal. The patient logs in and is now able to see the document. The same communication goes back, so the patient can also reply to the provider. The patient can also generate the information, it can request appointments, and a lot of different services can be provided via the portal and via secure messaging. As a reminder, whenever a patient comes and sees the provider, automatically the visit summaries are saved into the patient portal. So the patient can see this information directly in as soon as they log in after the visit. And there's more information, there are labs, there's the information that gets documented in the portal and they can access just by logging in. In terms of secure messaging and meaningful use, there's also requirements that have to do with secure messaging, specifically patient electronic access. Okay, so one part of this Objective 8 for meaningful use stage 2 is that you need to provide timely access to view online and download and transmit information to the patient for at least 50%. And the second part of this measure is that the patient has to log in and view that information and download it and transmit it from their portal. So this objective has two components. The first component is sending the information to the patient. How do we send the information to the patient? We make sure that when the patient updates their email information in patient information, you click on the patient information window, messaging, and at the bottom you have the option to send an invite. Once you send the invite, right here in the status, you will see that access has been granted. Once the patient logs into the portal, this status will change as online. So this invitation was sent, and now the patient has to take the second step, which is accessing the portal and registering. The second part of this measure is actually having the patients go into the portal and access their information. That one is a little bit more tricky, and you have to be kind of creative to make the patients go into the portal. So here we're just sharing some of the talking points that you can have with your patients. It's one way to encourage them is that to tell them that it is the best way to reach them. That is easier for them. If it's easier for you to reply if you receive a secure message. That they're not going to have to be calling. They could just send a message and they will be taken care of for appointments or for any type of request. And that they can actually see their lab results and information in the portal without having to call you and get that information. Now, one of the things that you have to keep in mind for the patients to continue using the portal is that you have to maintain it. You have to make sure that you're replying to the patients on a timely manner, and that you're sending them reminders, and that you're using it as much as possible. Another part of secure messaging and meaningful use is Objective 9. And Objective 9 has to do with actually sending a secure message to the patient. This one, even though sounds easy, sometimes turns into a challenge for the practices because on a day-to-day routine, it's hard for them to be thinking, okay, I need to send a secure message to a patient. And also not all patients are registering to the portal, which is the first part of this measure. So how do we do this? We just have some tips here for you. On a daily basis, just remind the providers that when they're reviewing their labs, if they see this option here, send secure message to the patient, the only thing they need to do is click on it, and the patient will receive a secure message with their lab information. This will help you to meet this requirement, this measure, and also it's a good customer service. It's gonna help have that information for your patient. Okay. Another tip is that actually you can set it up automatically. And in Intergy EHR, the only thing that you need to go is encourage the user, because this is user preference, to go into Intergy EHR setup, click on Preferences, General, and when they go into Practice Portal, they just need to use secure messaging to notify patients or when reviewing labs. In that case, the patient would automatically get secure messaging. So as I mentioned to you, today's training really was an overview of what direct message and secure messaging was and the difference between the two. One of the main things and the only thing I want to leave you with is that when we're discussing direct messaging, we're talking about information being sent from provider to provider, and when we're discussing secure messaging, is information being sent provider to patient. Before I go into that, there's here another patient engagement ideas, educating your patients every time they come to a visit. Make sure that you have some information available in your office to promote the portal and the website. Use promotional messages and advertise your portal. That's the best way to get the patients to engage and to start accessing your portal. Again, this is what I was reviewing for today's training, that just keep in mind that secure messages never leave your portal. They always stay in the portal, and the patient needs to log in order to see those messages, while direct messaging goes outside, and the patients and the providers, and the providers need to be participating with direct project. They have to have a direct email, and they need to be part of SureScripts or another health information service provider. As a reminder, the measures and the objectives that have to do with meaningful use stage 2 are Objective 5, which is health information exchange and transmitting. That one has to do with direct messaging. Objective 8, which has to do with patient access to their portal, and that has to do with secure messaging. And Objective 9 also refers to secure messaging. Moving forward for meaningful use stage 3, these numbers are going to go up. So as you become familiar with meaningful use stage 3, the objectives change and the numbers go up. In meaningful use stage 3, Objective 7 is going to be the objective for health information exchange, and the goal is going to be 50%. And The objective 5 will be the objective for patient electronic access, and the goal is going to go up to 80%. So this is something to keep in mind as you start getting your staff involved in utilizing these two functionalities. I'm going to be opening the lines shortly. Another thing that I added here is for your own information is some key terminology that you probably run into when you're hearing and listening about direct messaging, but it's hard to, this is all technology jargon, and it's a little bit hard to understand. So I'm just giving you a few pointers here so you can keep it for your own records. Health Information Exchange, HIE. The Health Information Service Provider, so a lot of times you're going to see HISP, and now you're going to know that it's for Health Information Secure Provider, and that in order to become a Health Information Secure Provider, you need to be certified. Secure Multipurpose Internet Extensions is what is used to communicate and to create the standards documentation. Advisory Committee Medical Establishment is part of the ONC that determines the standards. The Consolidated Clinical Document Architecture are all of the protocols that the documentation needs to meet in order to be a approved exchange document. Certified HR Technology is Intergy and Intergy HR. Direct Trusted Agent Accreditation Program is the accreditation program that they need to go through. ONC is the Office of National Coordinator, who was the organization and the government agency that started this project. And Simple Mail Transfer Protocol is what is used as a standard for the transmission. And Security Trust Agent, in our case, is SureScripts. I'm also giving you some resources, so you can click on the links that I'm giving you. I will make this presentation available after standing trainings. And again, the amount of information that you're going to find in the internet about direct messaging, the direct project, it's overwhelming, but I will tell you to stick with the health IT government sites. Those are the most accurate sites for information. Now, we are going to be discussing mainly the functionality of direct messaging and secure messaging. I am not going deep into meaningful use. That's why I'm sharing also our link to the meaningful use library that we have in our portal for HCN, where you're going to find a lot of useful documentation when it comes to directly for meaningful use and meeting these measures. So if you're familiar with their HCN portal, right there in our portal, you're going to find the meaningful use library. You click on it, and there's a lot of information in there that you can become familiar with. Okay. If you want to go more in depth into the actual protocols and standards, and I mean, you could really get lost into all the technical terminology, I'm providing the ONC implementation guide. And in here, it tells the health information service providers what sections they need to add to the exchange documents, how they need to be formatted, I mean, to the detail. It's very, very detailed. So if you're interested in that information, I'm also providing that document. Again, today was more meant for an overview of the two. Tomorrow, we're going to go deep into the how to submit a direct message. And on Thursday, we're going to go over secure messaging and how to work tasks for your patients, and if the patient is sending a request via the portal and things like that. Okay, I'm going to open the lines for any questions that you may have on today's presentation.